Hey guys, welcome to my YouTube channel. Wherever you are in the world, let me take this opportunity to welcome you. My name is Dr. D. Terrence Foster, and some of you may know me as an interventional pain management doctor. I'm also an author, and one of the books that I've written is called The Opioid Epidemic, Consumers and Healthcare Guides. This book is one of the most comprehensive books that have been written on the subject about the opioid epidemic. You could check out the description of it in the description section of this video. Now, I've received a number of requests asking about how do we manage pain during this coronavirus pandemic, and that is what this video is about today. Now, as you know, literally millions of people have been infected by the coronavirus, and tens of thousands have died and continue to die from this infection. We also know that so many of our lives have been impacted adversely in so many different ways. And for a pain patient, if you're there and you're sitting and you're saying, how am I going to see my pain doctor? Am I going to run out of pain medication? What can I do? I feel so hopeless, like everything is going bad. I'm here, I'm in lockdown, I'm sheltered in, and I supposed to be staying at home. You're going through all of these things, and I say to you, with respect to the staying at home, it is important that you obey those orders, as they will help us to better control the spread of this infection and save lives. That is so important. But let me say this to you, on the other end, you are not alone. There's literally over 100 million people in the United States who are suffering from chronic pain, according to the National Academy of Medicine. Now, who are these people that shows up at our clinic year in and year out? Now, we know that about 50 to 70% plus of these people are 65 years old and older. Now, what does that mean to us as clinicians? Now, people who are 65 years and older, generally, not all of them, have significant comorbidities, and some of them are immunocompromised. What do we mean by comorbidities? It simply means that they have underlying medical conditions such as diabetes, high blood pressure, maybe they've been treated for cancer, or they could also have renal failure, probably an hemodialysis. Maybe they have rheumatoid arthritis, lupus, and some of them will have disease affecting the lungs, such as COPD, emphysema, or asthma, or other disease of the lungs. Now, specifically those patients that have disease affecting the lungs, that specific comorbidity is probably of most significance, because the coronavirus, as we know it, is a respiratory virus, meaning that it affects our ability to breathe. And in severe cases, when it's affecting the lungs, what that results in is a cascading effect where we have multi-system organ failure. What that means is that all our organs begin to shut down. And if you're already immunocompromised or have underlying condition, then it makes the condition worse. And ultimately, if this is not treated aggressively, then that will lead to death. So the coronavirus in of itself is very, very bad. Now, in addition to those people who have underlying medical conditions or comorbidities, some of them are being treated with steroids, which suppresses the immune system. And for some of our pain patients who are on opioids suppresses the immune system. Now, we've heard in the news and in so many different quarters that non-steroidal anti-inflammatory drugs also suppresses the immune system. And there have been some studies, some that have suggested that. However, the one that I want to address specifically is that non-steroidal anti-inflammatory, such as Motrin or ibuprofen, it has been said that some of the patients who are dying from coronavirus are more likely, or probably have died more so because they were taking Motrin or ibuprofen. That has not been found to be the case. One thing I must say, however, is that if you're taking any anti-inflammatory medication or even Tylenol, then what tends to happen is that once you're taking that, and let's say you have a fever or you have joint pain, then those symptoms seem to be suppressed. Or if you're having a fever, the temperature does not get as high, or it may not even get into the range of what is considered a fever. Therefore, if you're taking those medication and you're having those symptoms, which are some of the symptoms of the coronavirus, you may say, well, you're asymptomatic, when in fact you're not. And in that case, you may have had coronavirus or symptoms of coronavirus and didn't know until it's too late or it's later on, and that's when you probably saw treatment. Those are some of the possibilities. But in general, non-steroidal anti-inflammatory, there's not a significant findings that can be supported with respect to coronavirus. All right, so there's some other things in terms of treatment of opioid that is worth mentioning. For example, if you're on say a fentanyl patch or a Butrine patch, patient that have elevated temperature, fever, then during that time there's a greater absorption of those medication into your system, and therefore you're at least an increased risk of having an overdose. So that's just something to bear in mind, even though the risk may be small, but it's there and it's something to be aware of. So now, how do you see your pain doctor? This is what you want to hear about. Now, there are a number of things that it's not just for pain doctor, but for all. You may have heard of virtual medicine, telemedicine, telehealth, telecare, chronic care management, all these different ways of seeing patient without the patient actually going to see their providers, whether it be their nurse practitioner, their PA, or their clinical nurse practitioner, whoever they're going to see. They instead of seeing them, they could literally have a conversation with these providers and get their treatment done, whether it's medication, where they could go and pick up their medication, or their medication is sent to their home. Now, this has been around for a long time, and usually there's some guidelines and some rules that has to be followed, such as, the people usually qualified to have these things, they're usually in some remote area away from the urban center. So they're out there in the boondocks, as we call it, and there's not enough providers to go to those areas, and therefore this was one way of meeting the needs of those patients. Also, one of the things that has happened is that these patients, certain other things rather, has to be in place. For example, the way the communication is done had to be encrypted, and there has to be, it has to be done in such a way that it protects the patient privacy in terms of their healthcare records. Now, what has happened since coronavirus has come into play is that some of these restrictions have been lifted. So now, you could literally, it doesn't mean that these things doesn't have to be adhered to, but of course they're not enforced as aggressively, or that's what we're told, that they're not going to be enforced as aggressively. Therefore, that means chances are you could get your prescription with having, I'll just say, a telemed conversation with your doctor, or a telemed visit, I should say, with your doctor or your provider, and you could get your prescription filled. So it makes it easier for providers that are right here in our local area, not out in the boondocks, but in our urban area or wherever, can use this this process or this system of medical management to facilitate or to prevent people from coming out of their home and to facilitate their treatment. So this is now in effect. Now, who gets this or who don't? Now, if you're a pain patient and you're in good standing with your medical clinic, then very likely you're qualified to receive this, and you will. Be in good standing meaning that you're not having crazy labs, or you're not doing illegal drugs, and you're adhering to your narcotics or your opioid agreement, then most likely you'd qualify for this. Now, those of you who do not qualify will most likely have to go into the clinic to get your prescription. Now, this is best suited for patients who already have an established relationship with their clinic. Some clinic or some practice have decided to use this for new patients. It's not something that I would recommend, but it is still within the bounds of practice. It's not doing something that outside of what is norm or normal practice. But some of us prefer not to do that. Some of us prefer to just use a telemed or those electronic non-face-to-face visit for our existing patient. Now, so if they're using telemed for you, then you could get your prescription. You either go to the clinic and pick it up, or you send someone with an ID. Different clinics have different ways, so check with your clinic to find out how they operate with their telemed visit. Now, in some instances, the pharmacy may be able to deliver your prescription, but you have to check with the pharmacy. In the case of narcotics, which is what we're talking about, opioids, usually there have to be a hard copy that is sent to the pharmacy. So the pharmacy have to get that in some way, one form or another, for them to deliver prescription to your home to begin with. So make sure you speak to your pharmacist, speak to your clinic, and find out what works for them or what they're comfortable doing, because not everyone operates in the same way. Now, so you get your prescription, and what about those who have to go to the clinic? Well, if you have to go to the clinic, make sure that, one, you wear a mask. Whether you're symptomatic or you're not, make sure you wear a mask. Everyone should wear a mask. The other thing that's important, when you get to your clinic, most likely you will go through a screening. The screening will involve, you'll complete a questionnaire, most likely, that will ask about your symptoms, it will ask about your travel history, and will also, and they'll most likely, most clinics will also check your temperature, usually before you get into the clinic proper. Now, if for whatever reason you think you have coronavirus, where you are symptomatic, you're coughing, you have fever, do not show up at the clinic. Make sure that you call before and talk to the clinic, and they will advise you on what to do. Now, so make sure that that is the case. Now, with respect to who gets seen in the clinic, there's some patient who will have to see regardless because they may have some emergency. Emergency may involve, for example, they have a pain pump or a baclofen pump. These pumps must be filled at all times. So provision has to be made so that they can be seen. Or they may have had, say, a spinal cord stimulator implant, which they've later discovered that they're having potentially or probably an infection, or maybe they may be experiencing some sort of neurological change which they consider to be outside of the norm. They need to be looked at right away. There are some other conditions that are somewhat borderlining on emergency. This may be, for example, acute herniated disc, or maybe some patient may have, say, herpetic neuralgia or trigeminal neuralgia, or some condition, or maybe a severe cluster headache, and they may say, I have to see a doctor. Some of those are emergency, maybe not, depending on who is looking at it and the condition. So all of those has to be looked at on a case-by-case basis. If you think you do have an emergency, in spite of the fact of all what's going on, make sure you go to the emergency room to get that resolved. Now, as a result of the pandemic, also one of the things that's been happening is that a lot of our clinics, in terms of pain management, there are certain things that we're not doing. We're not doing like steroid injection, epidural injection, and we're not doing a lot of the procedures that we typically do. For two reasons. One, steroid suppresses the immune system. We know that we don't want to add to that. In addition, we do not want, in spite of the fact that a lot of us who are doing this are very skillful and very well trained in this, we do not want to potentially have to send a patient to the emergency room because, God forbid, something didn't go the way that it should. So yeah, those are some of the reasons why we do not do these procedures right now. Okay, so that's pretty clear, I hope. Now, a couple of things I want to say to you is, one, what is your responsibility as a patient? Now, you have to realize, one, the pain or narcotic agreement that you sign with your clinic is still in effect. Corona does not cancel that. Just in case you're thinking, well, okay, now I can do whatever. No, you can't. If you find in violation in any of your narcotic or your pain agreement or whatever your practice calls it, it's very likely that you will be discharged. And we have ways of finding out what is happening. So make sure that you still abide by those agreements. Also, make sure that you're not doing, which also means that you're not doing any illegal drugs like marijuana, cocaine, or any sort of illegal drugs. The other thing we also like to remind our patient is that they should not mix alcohol and benzodiazepines such as Xanax, Valium, or Clonopin. Should not mix those with opioids. Those are very dangerous combinations that you should not do. So make sure that you abide by that. The other thing that I'd like to suggest to some of you who are there or dealing with this is probably a perfect time for you to consider reducing your pain medication if you're not on a lot of narcotics. You could try to take less or stretch it out for two reasons. One, you don't know when you're going to get back into a clinic sometime, or whether or not your pain doctor is going to still continue to give you this medication by the telemed route. So that may not be there. They may decide not to do that for whatever reason. They have that option. They may not give you that. So you may want to stretch your pain medication out. The other reason is that it may give you a chance to say, you know what, I really don't need this medication and I could get off them, which would be great. This may not be applicable to, say, someone who is in a methadone clinic program or someone who is on Suboxone. Those are more closely monitored, and I would suggest that you discuss those things with your doctor. And by the way, let me just say this at this point, nothing that I said here is giving you an instructions or a way to treat yourself, so make sure that you check all of these things with your doctor. Remember, I'm not your treating physician, all right? Now, this is a very, very important and a very difficult time for most of us, so make sure that you be safe out there, follow the instruction, wear your mask, and do your best to be a good citizen, because we're in a very difficult time and it's difficult for everyone, and we're trying to do our best as physicians to make this be not as difficult for you. So we need your help as patient also to do the same, and make sure again you take your prescription as prescribed and you do the things that you're supposed to do. So finally, thank you so much for watching this video. I sincerely hope that it was helpful. If you find it helpful in some way, please give it a thumbs up. Also, if you have not subscribed, please do so. There's a comment section where you could leave comments, let me know what you think. And if there's anything that you would want me to talk about, then I'll be more than happy to talk about. So just drop that in the comment section. I will see you again at the next video shooting, at the next topic, and in the meantime, remain safe until I see you then. Take care of yourself. Bye-bye.